Zoom for our seniors.
Right.
They have their virtual party, and he was there and gave blessings to one of those senior Zooms. So if you go down to, where is it on here? Yeah, over where it says stop video. Okay, or start video. There's a little arrow next to that on the right.
The share?
No, there's a little arrow right next to where it says stop video on the bottom of your bar. Okay. If you press that little arrow,
Okay.
if you have another choice in terms of background, then you can just click on that choice
All right.
and then enter. All right. Okay, we're on countdown.
And we 1 o'clock, exactly 1 o'clock, we start right up. So Ken, this is what's going to be up on the screen here. Okay.
Yes, do you see the flyer?
Yes.
Okay.
We're about 20 seconds from being live on Facebook. We're live.
All right, good afternoon, everyone. It's 1 o'clock on a Wednesday, May the 12th. You know what that means. It's that time of the month for Conversations with the Mayor. And we have a very important conversation. We have the topic we're going to be addressing today, talking about vaccinations. We talked about it a couple of months ago. Going to continue the conversation today. My name is Mark S. Lee. I'm your host, and we do this each and every second Wednesday of every month. Each and every second Wednesday of every month at 1 o'clock. This is also being shared via Facebook Live, and also posted on all of the social media channels across the great city of Pontiac as well. Before we get started, before I turn it over to Mira, I want to share a personal story. A story I think that in light of this conversation is very important for us to hear. You know, I know about the vaccination hesitancy and not telling anybody anything what to do. We know it's a choice, but let me share this story with you. I have 2 adult kids, and well, 2 adults. The one is my daughter just recently got married in the last couple of months, but my son's been married for a while, and he lives in Chicago. And they have my son and my daughter-in-law have 2 very small kids. Obviously, when COVID hit, I could not go to Chicago, and I wanted to see my grandkids. Long story short is I went over there for the first time last August to meet my youngest grandson, less than a year old, then for the very first time. Mask, washing hands, did everything that we were supposed to do. Went back over in October, again, washing hands, masking, and everything. However, at that point in time, my son and I both agreed. He said to me, Dad, you know, I love you, but we want to be extra cautious. And I recommend, which I totally agree with, he says, the next time we get together, let's be fully vaccinated. Now, a son is telling the dad says, absolutely, I'm in total agreement with you, son. So fast forward, I got my first shot early March, I believe. And I got my second shot early April, I think it was. So yes, I am fully vaccinated. And 2.5 weeks ago, I took my mom, who's fully vaccinated, and we drove to Chicago and saw my son and my daughter-in-law, who are also fully vaccinated. We timed everything out, and I walked in and got the biggest embrace with no hesitation, without thinking about anything. Was able to hug my son, who hadn't been able to do that to in quite a while. I was able to hug my daughter-in-law, and I was able to hug my grandkids. And the most special part of it all is my mom met her youngest great-grandson for the very first time. And we hung out for the entire weekend with no hesitation. And I tell you, God has blessed me, and I was so thankful. So I'm emotional talking about it, but I'm emotional because that was important to me. It was the choice that I made so that I could reconnect with my family. And to this day, I'm truly humbled and thankful and blessed. I share that story because that's what we're going to be talking about today. And I'm so pleased to welcome the mayor of the great city of Pontiac, Deirdre Waterman. Mayor Waterman, I'm going to turn it over to you.
Hi, Mark. We have been doing this conversations, bringing information and stories that relate to our populations for a number of months now in this conversation with the Mary series. So we got to be real sidekicks. Thank you again for being here with us and
You're
bring
welcome.
what we hope is another stimulated topic of conversation for this evening, for this afternoon rather. And I'm going to be introducing the guest panelists who are here with us today. But first, I'd like to talk about this particular initiative that we're introducing and rolling out. And that relates to the fact that what you're talking about in terms of the post-COVID reunion people are able to have in so many ways is being played out in so many households across the United States. But there are also so many households where people have not been vaccinated, where they don't have that sense of security, where they have fear or suspicion or misinformation or just hesitancy for whatever reason. And it is that numbers, even though the numbers are increasing of people who have been vaccinated, we're at about, 33% across the United States, about 55% in the state of Michigan. But we're still not at that 70% that the scientists tell us is the range of vaccination we need to have in order to be able to get back to the kind of normalcy of behavior and of security about our health that we need to get to. And so the question is how we get to that 70% or even more to achieve those goals. And there are many things that are prohibiting people from doing that right now as we listen to the community. And because of that, we are partnering with the city, Deb Brinson of Honor Community Health, one of our wonderful federally qualified health agencies in the city of Pontiac, actually the premier one in the city of Pontiac, and I decided we needed to do an initiative to do outreach of education, of information, and of help to lower the barriers and accessibility so that the others who have not been vaccinated have availability and accessibility for that. So we have two of the colleagues, my colleagues from Honor Community Health, here to talk to you. They are veterans of our conversations. They have been here earlier in the pandemic year to talk about, number one, how to get the vaccinations or what the vaccinations were all about. And that was in the era, remember, not so long ago when the vaccinations were in short supply and people were frantically trying to get registered to get their vaccination. So we've come a long way since then. Now we do have 3 different vaccinations are available. They're going to tell you Dr. Nikhil Hemady and Dr. LaToya Austin about what the status is right now, the vaccinations, answering some of the questions of the people who are hesitant or fearful or don't know how to access it, and are going to help us explain and roll out this initiative that we're going to do to reach out to our faith-based community to bring in more people to get this education and to get the vaccinations. And then, as representative of our wonderful faith-based community, I have 2 esteemed church and spiritual leaders of our community I'm proud to have who are on the program for the first time. And I do introduce Pastor Larry Spann of Community Bible Church, as well as District Elder Raymond Rogers of Zion Tabernacle, right here in the city of Pontiac. And we have discussed with them, they are fully cognizant of the needs of the community in terms of this initiative and want to be part of that, and also want to encourage other pastors and church leaders of the community to come and be part of this initiative too, and to introduce it to their congregation so we can extend that voice of people who need to know about what it takes to get the protection for their families, their friends, so all of them too can feel with confidence that they can get and hug their grandchildren, their children, and their resume those normal activities. We got a lot of summer activities and fall activities coming up. And in fact, I just left M1 Concourse where they're announcing the fact that for the first time, we've got several major events related to the automobile industry that are coming to the city of Pontiac, both Motorbella and American Speed Festival, as well as Dream Cruise and the Roadkill powered by Dodge. So those are just some of the activities, but people are getting back into the parks, getting back into wanting to go to the birthday parties and things like that. It's hard to believe a year and some months now, we've been under this emergency. So how can we get out? That's the question. And one of these ways we're going to get out is through this initiative that we're reaching out to outreach to our church-based community. So with that, I'm going to have, please, our guest from Honor Community Health to start out, Dr. Hemady, Dr. Austin. Where are we now in terms of the vaccination status? And what are the issues now that are keeping people from being vaccinated? And how will this program, in which we can actually take our vaccination clinics on site, where people can be in familiar circumstances and they can be vaccinated right there rather than having to navigate an online appointment system. So Dr. Hemady, Dr. Austin, the floor is yours. I introduce you, and please, you can begin.
And before they do, if you have any questions, please drop the questions in the chat box, please, and we will get to those questions a little bit later. I defer.
Thank you, Dr. Waterman. Mayor Waterman, we appreciate, on behalf of Honor Community Health, thank you again for having both Dr. Austin and I on this show. Again, we are truly our strong partners to help our city to get where it needs to be in terms of vaccinations, to finally say goodbye, kiss this virus goodbye, hopefully very soon. We are making very good progress on the vaccine front. I think the one thing that we have seen, we actually have about a good 5 months of data now to support COVID-19 vaccinations. And we've seen over the past couple of weeks, Michigan was #1 in the country in terms of COVID cases. We were #1, and that was a position that we obviously did not want to be in. Fortunately, over the last couple of, I want to say the last week and a half, we've seen a significant decline in the number of daily COVID cases. About a week and a half ago, our COVID-19 volume has gone down. The number of cases in the hospitals has significantly reduced. We still have a long ways to go, but it has reduced some of the burden that the healthcare system is experiencing. And at the peak of this, about 6 weeks ago, we were having almost 900 daily cases. If you look at a 7-day average of COVID-19 here in Oakland County, we are now down to about 125 daily cases, 7-day average. That is a significant drop. Michigan is unique because we are one of the states in the United States with the highly infectious variant of COVID-19. The UK variant has the highest prevalence in Michigan compared to any other state in the United States. And maybe I think it's Minnesota is also along the same line. And that is one of the reasons why we've seen a marked increase in the number of cases of COVID-19 in our community. And that is why it is so important to get vaccinated, because we really don't want this virus to mutate anymore and to give it an opportunity to create more variants than it is already doing. You're seeing this across the world. You've seen this in Brazil. You've seen this in India. You're seeing this in Nepal, etc. So we don't want this to be in the United States. We want to fight this virus with the only tool that we have, the only effective tool that we have, and that is the vaccine. Mark had a great story, and we appreciate him sharing that story with us. That is a story we're seeing being repeated over and over and over again in our community. Vaccine hesitancy is less and less, but now we really have to reach out to the community, and we'll use that, the same method that you said. We'll take the mountain out there. The Grubhub technique is what I call it. You know, we'll deliver the vaccine to you. We'll take it to where you need for us to deliver in an environment that where you're comfortable, whether it be in a Pastor Spann's church, where a location Dr. Elder Rogers has recommended, wherever that may be. That may be in your home, a location that you feel comfortable. I think we have enough vaccine supply, but we want to get all of our folks vaccinated. The last push. Dr. Austin?
I also wanted to address the lack of knowledge with our population. I think one of the keys to our residents, Pontiac, not wanting the vaccine is not knowing enough about the vaccine itself. And this is where at Honor Community Health, we can educate our patients. And we also recommend that they go to a trusted source, someone who they trust, someone who has value in their lives that could tell them about the vaccine and the benefits of the vaccine. Because what we realize is that they just don't trust the healthcare system. So we need to form some kind of a trust within our community so they can reach out to us to get the vaccine. One other thing that we also found is that they don't think the vaccine is safe. And I mean, we in the States, we've vaccinated at least over 260 million doses have been administered already. And so we know it's safe. One patient said to me, did you have an extra finger, an extra ear? No, we did not develop those symptoms. So I think we need to educate our patients about the safety of the vaccine. Also, one patient asked, is the vaccine effective? And it is, as Dr. Hemady mentioned, the rates are decreasing because the vaccination rates have increased over the last few months. So we know that with vaccination, we're keeping patients out of the hospital from getting to vaccination. So we really need to push that message out to our community. Also, we mentioned access to the vaccine. As Dr. Hemady says, we are willing to go anywhere and everywhere across the city to get the patients vaccinated. So I would recommend that we continue to do maybe weekly educational sessions so patients can be informed about the vaccine, the safety of it, and also instill a safety area for them to be able to go to know about the vaccine. Here, we are more than happy to vaccinate anyone who qualifies based on age for the vaccines. As you guys know, recently, Pfizer was approved for ages 12 to 15. So we are willing to go to the schools, go to buildings, churches, wherever we need to go to get the word out to vaccinate our community.
So Dr. Hemady and Dr. Austin, you've had some experience in trial runs and actually taking the vaccinations to actual sites and doing the site. So I'd like you to explain what it is that is particularly helpful about taking them this vaccination to the site, rather than having people to navigate that whole appointment process and to find their way to a clinic. You worked with me on helping to open the first vaccination clinic here in Pontiac, and that was at our own senior center, Bowman Senior Center. Now they have the large senior center, the vaccination site at the United Shore Soccer Center. So we do have max vaccination sites, but even so, there's some people who are not finding their way to those centers. So we're going to take the vaccinations to the sites. So tell us what is required for anybody who wants to have a site, what setup you have to have there. There may be others out there who say, I want to volunteer and have a site. I want to bring some people to have a vaccination experience. Can you explain that?
Dr. Austin?
Sure. All we need is a space. We bring the vaccine in a transportable refrigerator, so it's safe and ready to go. We just need an open area where we can have the patients come in once we have 6 feet apart so we can vaccinate. That's all we need, really. We need a contact person so we can get the dates scheduled and the time slots available. Also, if they have patients from that group, whether it be from a church, from a school, if you have lists of patients who want the vaccine, just let us know how many, so we can bring enough vaccine as well.
Another question I got asked several times was, which vaccine will be given? So that's the question still about which vaccine is better or not. Do you care to make any comment about that? And would you like to answer that question?
Mm-hmm. So, Mayor, we are currently offering both the Moderna vaccine and the Johnson & Johnson vaccine. The Johnson & Johnson vaccine is typically preferred by those individuals who hate needles. They want the one shot and done, and they're out of there. They never want to come back again for another vaccine. The Moderna vaccine is, of course, 2 doses, just like the Pfizer vaccine. The Moderna vaccine is 4 weeks apart. The Pfizer vaccine is 3 weeks apart. The advantage that the Pfizer vaccine now has that it's got expanded as of today. Hopefully later this afternoon, you'll see that the CDC is going to expand the coverage to 12 to 15-year-olds. The FDA has already approved it. The CDC is going to deliberate today. So that is the biggest advantage. Anybody 12 years and over can get the Pfizer vaccine. And Moderna very soon will also be applying for similar coverage for adolescents and children. But yes, we have the option of 2 vaccines right now, very soon expanding to 3. We believe that all 3 vaccines have very good efficacy or effectiveness, especially in preventing hospitalizations and in preventing death. And that's what we want from COVID, is preventing individuals from dying from COVID-19 and from getting hospitalized from COVID-19. Because the moment you get hospitalized, you know you've got other issues going on. You're pretty sick. We want to keep these folks out of the hospital and within there and keep them safe.
Very good. So I'm sure we'll have the questions for you. As Mark Lee said, please, anybody who's there who wants to have a question answered of any of our panelists, just put them in the chat box. We'll be doing that. But at this point, I would like to turn the floor and our attention to our 2 faith-based pastors from the area. First, introducing a first-time guest, Pastor Larry Spann of Community Bible, as well as District Elder Raymond Rogers of Zion Tabernacle, both here in the heart of Pontiac. Welcome, the first time on Conversations. And you heard Mark Lee describe his experience of having that freedom introduced by having the vaccination. And tell us about some experiences that you've had amongst your congregation members or others in terms of their experiences with COVID-19. District Elder, do you want to start, or Pastor Spann? Okay.
Right. Well, I'll go ahead and start then. So I'll make it easier for Pastor Spann.
Yes.
Well, first off, we are now back resident in service. And so for those that feel comfortable enough coming to service, we certainly hold to the CDC guidance, if you will. Come in, we deal with temperature checks. We deal with the hand sanitizer at the door. We still hold to, as entry, to wearing of the mask. And at this point, I am very glad to say that several individuals within our congregation have actually been vaccinated. Why it is so exciting for me to say is because, I led the way. I've been vaccinated since February of this year, and I mean fully vaccinated. And so I continue to have that announced from 1 week to the next. And I've gone to the extent of really sharing with individuals, not only the sites or numbers, but if they desire to actually be vaccinated and are having difficulty, I have personally tried to kind of help walk them through the process. And so we can maybe discuss a little bit more about what we're interested in doing as we continue to go. But in answering your question, those are some of the things we're doing right there at the church itself. And the excitement now is that we're more able to just kind of share and enjoy each other in a more cordial way without the, if you will, the nervousness of the individual virus that's hanging out there. We understand the reality of it, but we know we've done what we can do to secure ourselves. And ultimately, our trust is in God. And so we are pretty comfortable as we continue to move forward. And I'll let Pastor Spann address some things that are going on in the community.
Thank you, Pastor. Thank you, Mayor. As my friend, Pastor Rogers stated, we too have regained access to the building for worship, and we're excited about it. As he stated, some of our members are fully vaccinated, some aren't. But what was exciting to me with speaking with the mayor was the ability to use our facility as a site for those that may be willing to and desirous of being vaccinated. And then the education part, it was another key piece for me, for those to come and get information. And so Pastor Rogers and I have talked about teaming up and using our facility as a site where that can happen. I personally have not been vaccinated, but I have had an experience with COVID. And so it's important, as I heard, I believe, Mr. Lee speak, we're not here advocating or trying to convince someone that they should get the shot, but we are saying if this is something you desire to do, we want to be a conduit by which it can happen. We want to be accessible. And so we're excited about that. And I'm looking to lead the way and join Dr. Rogers in becoming fully vaccinated myself. And so we're excited about this because we want, again, the name of our church is Community Bible. So we should be here, a part of the community, as I said, a conduit for those who need access. And that's what we want to offer to the table, Mayor.
Well, we heard it right here, late breaking news on Conversations with the Mayor. We have one of our esteemed church leaders right in this community say he's won over, he's going to get his vaccination, he's going to lead the way. So what better? That's exactly what this outreach mission is about, to link the church-based community, the members, with the people that they admire, respect, and have confidence in. And that is what you represent and are the role models for other church-based leaders, pastors, priests, whatever denomination, who can also be the conduit to get this information, this initiative to their members, so they can have the same experiences that Mark Lee has in terms of having that feel safe, that security of now being able to mix out in public. And in this long scare of this COVID-19 we've been under for so long, and we want our lives to get back to what we used to experience and to love and to enjoy. So given that, Pastor, what was it that you experienced that made you now change your mind? And how do you see that being played out as we bring this initiative where we can have the Honor Health community doctors bring the vaccinations directly on site? How do you think that will help your members, and how do you think that will be received?
Well, I think it'll be received very well because, again, it's a familiar place and people are comfortable here. And again, the other thing, as I stated, with Dr. Rogers and I teaming up, it'll allow for a sense to show the community that we're all working together to keep, like I said, get to a place where some normalcy, where we can fellowship without the mask. Because if, as you stated, if we could reach that level of 70%, it helps us all be able to have those family outings and gatherings again, where what we're used to. So I'm excited about it.
Good. So District Elder, and that's another good theme that come out of this, people teaming up. We're teaming up with Honor Health to bring a health initiative to the city. We're teaming up with the churches in our community, of which we have many very highly respected leaders who people feel safe in that setting. And so we're teaming up with Honor Health to bring the vaccinations to a place where people feel safe. They feel they can ask questions. They're seeing other people get it. And they don't have that wait time. The doctors will come not only with the fact sheet, but they will also come with the vaccination. So you can get them both at the same time. So as soon as you say, hey, look, I understand now, and my questions answered, I'm not fearful, you line up, get your name down, get that shot. And it happened so fast. I was talking to my mother who was across the way getting her shot. And as I finished talking to her, I realized it already vaccinated me. So it happened that quick. And of course, in Pontiac, we had the initiative for people to, once they had gotten the shot, they got their sticker saying, I got my shot. And I had 80 and 90-year-olds walking around. And so with their stickers saying, I got my shot. So for their 20 and 30-year-olds who were not saying they weren't going to get the shot, more immortal, and they were afraid. Well, if we had 80, 90-year-olds saying, I got my shot, then the 20 and 30-year-olds said, oh, well, maybe I don't have anything to be fearful about. So anyway, we're just all working together for community benefit and for health reasons. So how soon you want to get your vaccination, Pastor Spann? How soon we want to set up one of these clinics at the church?
Yeah, and I heard the doctor say, and we'll talk afterwards to see what's their first availability that'll coincide with Dr. Rogers and I schedule, but we want to do it immediately. I'll tell you this, I believe you have these sessions every the second Wednesday of every month. So let's try to do it before your next town hall meeting.
All right. Well, between now and our next town hall meeting, I will be using your names, Pastor Spann and District Elder, as we go out, and we're going to call and reach out to all the churches in the area to see what part they can play, you know,
Yeah.
in helping this. And we will use your names and saying if they've been the trailblazers in getting this initiative started, but we want this to be throughout the city. We want to be a city that reaches that herd immunity so that we can go back to our normal work, live, and play that we're known for and get back to normal life again. So any other comments about how we can help you and what fears you're hearing from your members, pastors, that you can share? And so reach out to the wider audience. If your members are experiencing some fears or some suspicions, then others are too. And they may be here in this broadcast so they can hear you talk about it.
Yeah, I just seen a couple of comments come across the screen that's dealing with those fears. So is Mr. Lee going to read those
Yeah,
comments?
if I can jump in, just
We're
do
going to get to that right now. And I
Yep.
turn it back to you, Mark, so we can have our question and answer.
Thank you very much, Mayor. Absolutely. What we're going to do now is to open it up. We have 10 minutes, less than 10 minutes remaining, just a time check. And Pastor Spann, yes, I want to give you the opportunity to address, we're getting a lot of comments about some misinformation or some perceptions out there, as you can see in the chat room. For example, there are a lot of vaccinated people that's catching COVID. You know, some people, how does the COVID vaccine help the Black community at all? So those types of questions, and there's a quote up here I'm going to read as well, which is, there are still cases of people catching the COVID after the vaccine. So let me start, if I could, Pastor, hold off for 1 second, if you could. And I want to go to the doctors briefly and address that very first one about cases of people catching the COVID after the vaccine. Dr. Austin, would you like to try that one?
Yes. So remember, after your second dose of Pfizer and Moderna, you have to wait 2 weeks to be fully immunized against the virus. So we are not sure if the individual has received or got COVID within that 2-week period. Remember, no vaccine is 100% effective, correct? So you may have a 95% chance of not being infected with a COVID infection. And there's a small percentage that you could still get the COVID infection. However, the risk of you having a severe case is a lot lower than if you didn't have the vaccine. So the vaccine protects you 2 ways. One, the first one, it gives you, and it allows you to produce antibodies. And those antibodies can then block the virus from entering your cells. So that's one way of protecting yourself from the infection. The second thing, it produces another cell that could help kill those infected cells at a quick rate so you do not develop a full-blown infection. So the vaccine is in fact effective, but we know that you'll always find a small percentage of patients that will go on to get the infection, but just remind that it will not be a severe infection.
And I have a direct message here, Dr. Hemady, I'll turn over to you about what these vaccinations, you know, we're hearing about the variants. And are these vaccinations going to take care of this variant from, you know, Africa, wherever these countries are coming in from? I apologize, I don't remember off the top of my head. But if I'm vaccinated, will that protect me against those variants out there?
Just wanted to add one quick thing. The chance of getting individuals who got the COVID-19 vaccine, they're only less than 0.01% of them actually developed COVID. And the infection that they developed, majority of them had a very mild form of COVID. So you can see how effective, this is one of the most effective vaccines we have in our entire armamentarium to fight any infection, actually.
Right.
So this speaks to the effectiveness of the vaccine. But going back to your question, Mark, absolutely. The vaccines currently that we have on the market, especially we've got great data from both Pfizer as well as Moderna. And you can see that in Michigan, in spite of the high prevalence of the UK variant, which was a very infectious strain, a very contagious strain, you can see as the vaccine numbers have gone up, we have seen a nice drop in the number of COVID-19 cases here in Michigan, in spite of there being a very contagious variant here in Michigan. So that speaks to the vaccine.
Another question before I engage the pastors again about the information push out, share out. Once you get vaccinated, a couple questions here. Once you get vaccinated, do you need to keep getting tested? Number one, and number two, will you always test positive, after you've been vaccinated as well? So 2 questions there.
So once you get vaccinated, and after you've completed, as Dr. Austin mentioned, you're 6 weeks out from your first dose, or 2 weeks out from the second dose of Pfizer or Moderna, or 2 weeks out from this first dose, and the only dose of the Johnson & Johnson, you do not need to get tested for COVID-19 unless and until you develop symptoms that suggest COVID-19. That is the only time that you can need to get tested. And that is one of the reasons why you do not need to quarantine after you get exposed to somebody, after you get fully vaccinated. Amazing. Yeah.
Dr. Austin, would you like to add on?
No, he's absolutely correct.
Okay. So what I want to do, if I could engage the elder and Pastor Spann about the information share out. We're hearing even here just some concerns and hesitancy in some of the comments. So as your churches are engaging the community with the mayor's office in the city of Pontiac, for example, how are you going to continue to address this information that's being shared that may not necessarily be true, or people have that perception, right? And we hear how the doctors are responding to those concerns. So as faith-based leaders in the city, the community, how are you going to address those concerns with your congregations?
I guess I'll go first. I think it's important to, be honest and say this pandemic that we're experiencing is fluid. In other words, we're learning as we go. We're learning, we're taking data and information and using it to best protect ourselves as possible. And so it's rather important to get information towards emergencies. The more information we get out there, the less likely we are to have, January the 4th was my birthday, and my grandmother, Mother Walker, died on my birthday from COVID. 2 weeks later, I contracted COVID myself, was in the hospital. The doctors actually told me the day that I went to emergency, they told me that I was so sick. Not only did I have COVID, but I had pneumonia and needed a double blood transfusion and my acute kidney failure. And they said, I didn't want to go into the hospital, but he said to me, he said, Pastor Spann, I assure you this, if you don't allow us to admit you in the hospital, you won't make it through the night. He said, we can't guarantee you're going to live if we admit you, but I can almost guarantee you won't make it through the night if we don't admit you. Yeah. And so that's my personal experience. Okay. And so we simply want to give information so that you can make an informed decision that's best for you. And perhaps it's not something that you will decide to take, but don't stop someone else who has made the decision based off of information to get it. So that's where we come into play to help get the word out. And so I'll move over to the side and let Dr. Rogers speak.
Dr. Rogers, please, and then we're going to get ready to wrap up, please.
I'm going to do this quickly, and I'll just deal with, if you will, the elephant in the Zoom that we create. Doctors, we appreciate your information, and it is certainly valuable. But here it is when we deal with the real people on the street. And since I'm a pastor, I'll deal with both naturally and then deal with it spiritually. In the Black community, because I see in the chat, there is specific concern that revolves around that Tuskegee experiment. Here is where I will say your ideology regarding the Tuskegee experiment and the vaccination process, your ideology seems to be flawed, because when you deal with the Tuskegee experiment, they in turn, they did not have patients with informed consent. So they did have consent, but they were not really informed as to what they were really dealing with. Here in this case with the vaccination, you are fully informed of what it is doing and what it is revolving around. When you dealt with the Tuskegee experiment, they were treated for bad blood, which is so general and generic. But this was specifically the vaccination is for prevention, not for actual treatment itself. And then I would say, lastly, if you want to even try to compare them, this is how it is flawed, because that in a Tuskegee experiment, they dealt with free medical attention following the individual shots themselves. And so they dealt with continued medical care so that they can examine what went on. And with the vaccination, you are receiving your inoculation and they're saying, go live and enjoy life. And so there is not all of the follow on. So they're not examining what goes on. That's from a natural side. And if I can quickly hit the spiritual, and I'll get right out your way. Oftentimes we use the Bible to support not getting vaccinated. And some will pull from Exodus chapter 15 and verse 26. And it really deals within the latter clause, I am the Lord that healeth thee. And so if you would take the full verse, there are some requirements in there before you even get to the place of the Lord healing thee. And so if you're not necessarily doing those requirements, you haven't met necessarily the minimum to even ascertain what the latter clause of the verse discusses. And here is where I'll leave it from a spiritual standpoint of I am the Lord that healeth thee. A healing then comes after you actually have something. The vaccination itself from a spiritual sense will help you to not even be the individual carrier of that virus. And so the Lord wouldn't have to heal you if you don't have it in the first place. So naturally and spiritually, you are dealing with flawed ideology if you would honestly step back and take a look at it. And so, Mark, I'm gonna get out your way, my friend.
No, you're good. And what I want to do,
Can I say one last thing?
one last thing.
Okay, I didn't catch the gentleman name, but I want to say it was Fino Corey, someone that continues to make comments, because I don't want to disregard his or anyone else's opposition. And I think we can have great discussion with people that don't agree with us or have a different position. And so it would be nice. I'd like to reach out to him or whoever in the comments, because I think bringing in other people's, even that don't agree with us, that having their position where they could have a part of this panel discussion in the future as well.
Okay, thank you there, Pastor. I appreciate that. What I'd like to do is to turn over to the mayor for some final comments, and I'll wrap it up as well. Mayor?
Well, I think we've had a perfect wrap up from our spiritual leaders here, both the district elder as well as Pastor Spann. And to that, I can just say amen. You had not only from the scientific, but from the spiritual. And so what better to prove that this initiative can get the kind of results that we want and the kind of participation. So they've given an example of the kind of leadership they can show. And also emphasize the point that we were now bringing this initiative where people can come to us a session that they're familiar with people that they are familiar with, that they believe in. And so what better to talk about why the choices should be made and what your options are than our spiritual leaders. So I thank them for being here. They will add quite a dimension. So now we're dependent upon them as we reach out to any of the churches that want to have the same initiative brought to their church. You've heard it here from our two pastors today. And with that, I can add nothing more to it, Mark, than to say for those of you who want to see this again or want to pass this along to your friends, this broadcast will be available as well on the Pontiac website, city's website, on the Pontiac City YouTube page, on the mayor's Facebook page, on the Pontiac Connect mobile engagement app from your smartphone. But also, if you want other information about where to see it, you can call our hotline, 248-758-3300. So there'll be many ways that people can see this who didn't see it or want to see it again and pass it along to their friends. And with that, Mark, I say to you, Thank you again for being our host. And we've had another rousing, I think, conversations with the mayor.
Absolutely, Mayor. And what I just say in closing as well is to the individual who's been posting comments, please feel free to reach out to Pastor Larry Spann directly. Please feel free to reach out. The mayor mentioned the church that he's involved with, and certainly he's willing to have a conversation with you. And as we close out, let me say that our next conversations with the mayor will be held next month, which will be June the 9th. That's the second Wednesday, June 9th at 1 o'clock. At 1 o'clock sharp, we start. We will always have the thoughtful conversations, and we want you to tune in and spread the word. Tell as many people as possible. And with that, we want you to go out and make it a great day, make it a great week, make it a great month. And we will check you out next month with conversations with the mayor. And I will also check you out on radio this weekend on 19 a.m. Superstation in the conference with Mark Esley. Have a great day, everyone. Stay safe. Thank you.
Thank you to our panelists. Thank you, everybody who attended.
Yes.
Bye-bye.
Thank you.